Dr. Shamra Boel-Studt is an assistant professor with the Florida State University College of Social Work, whose research focuses on children and adolescents in residential treatment facilities. She sits on the Quality Standards in Group Care statewide work group and serves on the editorial boards of both child and adolescent social work and residential treatment for children and youth. She has led or co-led numerous child welfare-related projects, including the institute-funded Assessment of Quality Standards for Florida's Department of Children and Families licensed residential group homes. Dr. Boel-Studt is a current faculty affiliate of the Florida Institute for Child Welfare and is here today to talk about residential care and effective strategies for children and youth with high-level needs.
So children with high-level needs are those whose needs for various reasons are greater than what we would tend to see among children who are in the same age range or developmental stage. So these can be things like cognitive needs, behavioral, even physical or medical related needs. For some of these kids, this can be driven by their environmental experiences or care. That might include, conditions in the home or in the community that are either driving or exacerbating some of the needs that we're seeing or the issues we're seeing in these kids. Sometimes it can occur as a result of, perinatal or prenatal, care or conditions or, during birth. But essentially, to help children with high-level needs meet the basic developmental milestones, we need to engage in additional effort to try to understand what their needs are first, and then that often involves, seeking out additional supports, whether it's, finding ways to support the caregiver through skill development, or even, accessing services like behavioral health services or educational or medical services to help them meet those important milestones. So that's generally how I would define children with high-level needs. And then within that, I think we have really a lot of heterogeneity, right? And differences in terms of level of severity. So when we look at the child welfare system, the prevalence or the concentration of children with high-level needs is substantially greater than what we see in the general population. So in the child welfare system, these kids are, they have a high prevalence of exposure to childhood adversity and trauma that results in heightened levels of, traumatic stress symptoms, sometimes PTSD, other, cognitive and behavioral health related issues. We also know that early exposure to trauma can impact children's neurological and social emotional development, and that can have long-term impacts if left untreated. So then when we look at kids who are traditionally served in residential settings, all of those issues apply, but it's even more prominent there. So there's been a number of studies that have compared kids in residential care with the general foster care population, or kids who are served in other settings, like, are receiving in-home services or outpatient mental health services, or, they're placed in family foster care. And what those studies overwhelmingly find is that children in residential care have upwards of 3 times a greater likelihood of having a psychiatric diagnosis, and upwards of 6 times more likely to have behavioral problems listed as a reason for removal or a justification for placement. And when we look at trauma histories comparing kids in residential to other settings, there we see kids in residential care are more likely to be exposed to complex trauma. So that's prolonged exposure to trauma or traumatic experiences or events, or exposure to multiple types of trauma. So one study, for example, compared kids in residential care, and this was a multi-state study, with kids who were receiving community-based mental health services. And they found that the kids in residential care, 95% of them had met qualifications for complex trauma compared to 77% of the kids in the community-based care setting. And then in addition to that, when they compared functional impairment scores across groups, they found that the children in residential care were more severely functionally impaired across multiple domains. So all of them they assessed that included behavior problems, attachment, academic, and substance use. The other thing that sets that group apart is they tend to be older on average. And then when you look at their care histories, these tend to be youth who are they're considered a little bit more challenging to serve, and it's a little bit harder to find stable placements for them. And so I think we can look at the population of kids in residential care as being part of a vulnerable population that stands out as being even more vulnerable. That's a good question, and the short answer to that is that we don't really know. With FFPSA, the shift is on prevention, right? And so the goal there is that we can engage in services that might prevent children from disrupting from their homes, and that we can serve those kids who do disrupt in the least restrictive care setting possible. And I think, for the most part, nobody disagrees with that, at least philosophically. But with FFPSA, unlike other major pieces of federal legislation, there weren't smaller demonstration pilots that preceded its passing that could have been used to inform how to most effectively implement some of those requirements in practice. And so we're left with this major child welfare reform without having some of the questions fully examined in terms of how is this going to impact the kids. And one of the concerns is that it could result in some unintended consequences that are disproportionately going to impact children with higher level needs that have traditionally been cared for in residential care. But we can make some educated guesses about what some of the impacts will be, and we're already starting to see some of this. So we know that the FFPSA is going to reduce the number of residential placements that are available, and so that translates into fewer available placements for kids with higher level needs. And this is presumably based on the assumption that we can serve some of those kids, or a good portion of those kids can be served in lower level care settings. However, that's a largely unexamined assumption. And so we're probably going to see a lot of those kids that were previously served in residential care settings being shifted to lower level care settings. And when you look at the research and, if you've spent time reviewing child welfare data, what we find is when you place these kids in lower level care settings, the risk is that it's going to result in a lot of placement disruptions. Now, it could be that for some of these kids that, if you look at them relative to other kids in those settings, maybe they're doing well. And there's some emerging research, including my own, that's focused on trying to identify who those kids are that we might want to shift out of residential care, because maybe, they could do just as well in a family foster home with the right supports, or do well in an in-home care environment with the right supports, right? But that research too isn't well developed enough at this point that we could just point to who those kids are. And so it's really hard to say at this point that for that subset of kids that, family foster care is the right solution, or these other service options are the right solution. We just don't really know. And that's part of the problem with these large-scale blanketed policies, is they just don't apply to or affect everybody in the same way, right? Or they don't even have the same implications across localities. So if you look at something like residential care, how it's being used in one state to another can vary pretty substantially, and how it looks can vary quite a bit. Even in larger states, like Florida, the composition of residential care across regions differs quite a bit, so FFPSA is going to have a differential impact depending on what region you're in terms of service loss and how we're going to compensate for that. The other thing is with FFPSA, the services were cut before we found effective, proven alternatives for kids with higher level needs in the child welfare system. And so to me, it seems like in child welfare, we can't quite move away from this approach of sort of prefabricating our service array and then retrofitting that to our service population, where it seems like what instead we should be doing is taking kind of a deep dive into understanding our service population and then fitting the service array to that, right? But at this point, I think there is, given that we're kind of in this space of not really knowing what these consequences are, and we're watching the states sort of figure out a plan, I think there's a great need, a critical need for child welfare stakeholders to engage in efforts to, assess these kids, to try to figure out who they are, and then to track their trajectories and outcomes as we kind of implement FFPSA, so we can identify what strategies were more or less effective for these kids. Okay, so generally speaking, services that are family-based, that are trauma-informed, that are assessment-driven, and that are collaborative, those are kind of rising to the top of the best practices. And then within that, there's a lot of evidence. I shouldn't say a lot, but there are evidence-based models that can be implemented in practice. If we look at the bright side of FFPSA, kind of going back to focusing on the residential population, it's kind of forced the child welfare field into this place where they have to reconsider residential care and its role on the service continuum. And that's something that's long overdue, actually. So for too long, residential care has been kind of existing as a placement of last resort, and it's kind of been reduced to sort of a catch-all in some cases. There's a lot of heterogeneity there, so that's not the case for all residential programs. But, any service continuum that's designed to serve vulnerable children and families, it should be unacceptable that there's a space on that continuum where there's a modality that's considered last resort, right? And so I think that FFPSA puts us in this place where we can look at it like we have an opportunity to reconsider what residential care should be and revision it. And a part of that, I think, involves starting with understanding who are the children and their families who have been traditionally served in residential care. Are there a subset of them that we can move to lower level care settings that would be, and they would do fine there? And who are those that would benefit from care in a more structured setting like residential care? And even beyond that, for whom of those is residential care or some form of it a preferred treatment option? And then from there, I think it's understanding given our understanding of the population, what models of residential care do we need? And then within that, what should they look like? And so that's kind of the aim of the Quality Standards Initiative, is to identify the core or principal components of effective high-quality residential care. So with the Quality Standards Initiative, we've partnered with the Florida Institute for Child Welfare and the Florida Department of Children and Families, as well as the Florida Coalition for Children and a network of providers across the state, with the goal of establishing a set of research-based quality practice standards for residential care, and then from there to develop an assessment so that we can measure how well residential programs are doing at meeting these standards. The other purpose of the assessment is that it allows the state and providers and the CBCs to monitor care within each of these residential settings, and it also facilitates the uptake of the standards in those settings. So it's a way of kind of establishing, here are the practices we want to see, here now we're monitoring them, and then the other space is trying to facilitate a process of continuous quality improvement. And now that we're 5 years into this, with the assessment, it's the Group Care Quality Standards Assessment, has been piloted and fully rolled out across the state. And through ongoing research, we are accumulating increasing evidence to support that it's, the effectiveness of the implementation, the validity of the assessment and the standards. And at this point, we're also starting to generate some emerging evidence that it's having positive impacts on residential care practice, with providers using the assessment as an opportunity to look at their models and to figure out how they can kind of define them better, to start using validated assessments and to become trauma informed. So we're seeing a lot of that movement in practice. So at this point, myself and my collaborators feel that we'd like to see this kind of the Quality Standards Initiative build some momentum beyond the state of Florida, because we think it could be a tool or kind of a framework in that goal of redefining residential care. So it's not going away, but moving forward in the future, let's figure out what it should look like and how to use it the best that we can, and we need some mechanism to do that. So if folks want to learn more about the Quality Standards Initiative, they can go to the Florida Institute for Child Welfare website and look at our webpage, and we have several reports on there that describe the work that we've done here in the state. There's a journal out there that is all about residential treatment for children and youth. It's called Residential Treatment for Children and Youth, and it is targeted to providers and researchers as well. And a lot of the articles that are in there are based on collaborations between researchers and residential care providers, or providers at some level. And really the aim of that journal is to kind of create a forum for how we can improve upon and build evidence to support effective residential models of care. And then additionally, I often get inquiries sent to my email, and people just ask me about residential or child welfare related things, but I'm happy to have folks contact me if they have questions, and I'll send them journal articles or point them to different resources. And so my contact information, I believe, is available on the Florida Institute for Child Welfare website, but also on the Florida State University College of Social Work website.